Good morning, everyone, and welcome to this session of the Government Operations and Fiscal Policy Committee and the Health and Human Services Committee. This is our joint session today. We have two items. First is a special appropriation to the FY26 operating budget for the Department of Health and Human Services for respite care, senior nutrition programs, and home care services for adults. I want to first, before we get to this item, thank my co-chair of HHS, and I'll turn it over to her in a moment, and to our Department of Health and Human Services for addressing and identifying the areas that we need to make sure that we're continuing to fund here in the county to support our residents, particularly those who are most impacted by the federal cuts that we are seeing. And we know this is a very difficult time, and especially for our Department of Health and Human Services, as you all are trying to figure out what all the changes in the federal government, in contracting, and in grant making, how that's going to impact us here in the county. And so I just want to say thank you to my colleague, Chair of HHS, for jumping in and leading this effort to make sure that there is continuity in services and that we are making sure that residents have what they need. The next item we'll take up after that is a special appropriation for our resident and community gardening grant program for $100,000. And so I'll turn it over now to my co-chair of HHS.
All right. Thank you, Madam Co-Chair Stewart, for joining me for this discussion, this joint meeting. Thank you to my colleagues. Thank you to our analysts who prepared this packet, HHS leadership who took the time, Dr. Bridgers, to attend all 10 meetings, virtual, in person, in 1 week. It was a fast track to have a deeper understanding of Health and Human Services as the new chair of the committee, and then also get a deeper look at some of the gaps and challenges that exist in our community and how the federal government cuts have impacted services and program delivery on the ground. And so I'm excited to discuss the special appropriation, which will protect some of our most vulnerable residents, our seniors in our community, focusing on respite care, in-home care, and most importantly, senior nutritional services. We have residents who are on the wait list, residents who could not even sign up for the wait list, that we will be able to help now with these resources. And so I look forward to the discussion and questions, and I'm ready to get started.
Great. Thank you. Dr. Bridges, I will turn it over to you.
Good morning, Madam Chairs. It's always an opportunity to present the need, especially in this community. We are an age-friendly community recognized internationally. And as you said, Council Member Sales, thank you for diving right in to look at the complexities that are within the Department of Health and Human Services. When we think about need-based support and funding, special appropriations may come hot and heavy, but our team has done their due diligence, their research, and all the work that we've done. We have a very robust presentation, a lot of data, a lot of slides, a lot of what-ifs to hopefully answer your questions. Our team is ready. I'll turn it over to Dr. McGee to walk through our presentation, but this is the landscape of what we have before us and you with this federal administration. The fiscal cycles are off. They aren't on a calendar year, but on a fiscal year. And so when you look at overlap and you think about why now, these are some of the reasons that we present these supplemental appropriation requests to you now, because they are off schedule and off cycle. So the need is warranted, and we have a lot of information to share, and hopefully they will answer your questions. Thank you.
Yeah. No, I think we'll go, is it okay with our staff if we go through the presentation first, then I'll turn it over to you to go through the packets. Thank you. I get thrown off by being on the 7th floor. And you all over there.
Bear with
So,
us.
Dr. McGee, we'll turn it over to you.
Good morning, everyone. Happy Monday after the Super Bowl. I am Dr. Patrice McGee, and I am the Chief of Aging and Disability Services. First, I want to thank HHS Committee Chair Sales for her leadership in introducing this special appropriation, to County Executive Elridge for his full support to shore up the safety net, and Council President Fanny Gonzalez for her full support of the FY26 supplemental appropriation for A&D. So this morning I am joined by an amazing cadre of leaders. My A&D leadership team is seated behind me and will come to the table for questions. In the room today we have Kim Mayo, who is the administrator for the Community Support Network for People with Disabilities, Mario Wersussen, who is the administrator for the Adult Protective Services Case Management Services Division, and Dr. Kimberly Johnson, who is the director of the Area Agency on Aging. The programs before you today are core safety net infrastructure for older adults, people with disabilities, and their caregivers across Montgomery County. Next slide. So, as you will see, some FY20 highlights on this slide. Aging and Disability Services supports residents across the lifespan with complex needs, with a growing focus on older adults and individuals with disabilities. In FY25, demand continued to rise across key services such as nutrition, home care, respite, and protective services. This chart highlights the success and impact of the programs where funding is critical to maintain and restore access, reduce harm, stabilize daily life for residents already at risk, and provide consistent, reliable, and timely services. The supplemental appropriation before you is intended to restore balance and stability. Next slide. Aging and Disabilities' mission is to affirm dignity, independence, and inclusion, and that mission is grounded in evidence. Research consistently shows that home and community-based services cost roughly half as much as institutional care. Long-term home care lowers overall medical costs by 14% and reduces inpatient admissions by 35%. Our program goals are allow participants to age in place in the least restrictive and safest environments while promoting choice, independence, and inclusion. According to a 2021 report by AARP, if given the choice, 77% of adults would prefer to age in place, stay in their home, or the community. Least restrictive, safest environment. Over 60% of individuals with disabilities report that their preferred living arrangements is in their home. Even among those requiring long-term services and supports, roughly 3 in 4 prefer to receive care in the community. This supplemental appropriation matters because it allows us to invest in what works, keeping residents safely in their homes while reducing downstream costs to the county. Next slide. Today, 22% of Montgomery County residents are age 60 and older, and that population is growing nearly 4 times faster than the under 60 population. Without action, growing demand turns into growing wait lists, and wait lists create risk, unnecessary institutionalization, increased abuse and neglect, and higher rates of financial exploitation. This is not a future problem. It is happening now. And the funding before you directly addresses these risks. Next slide. Turning to Senior Nutrition Program, there are 141 seniors and adults with disabilities currently waitlisted and at risk for food insecurity. Federal COVID funds have expired. This is relevant because these one-time grant dollars enabled program expansion, which was a requirement of the grants. The Older Americans Act has not been reauthorized. Note, Recently, February 3rd, there was a continuing resolution that flat funded the Older Americans Act through September 30th. Loss of COVID dollars, lag in federal funding, and demand resulted in temporarily closing the senior nutrition program application to new applicants. Nutrition is foundational, not just for health, but it promotes independence and social connection. This funding restores access to meals and prevents isolation, decline, and avoidable health crises. Next slide, please. So you'll see here on this slide, it shows who is most impacted. Communities of color are disproportionately represented among those served and among those now waiting for nutrition services. This appropriation is also an equity investment. Next slide, please. Home care services are similarly strained. There are 345 residents that are waiting to be assessed for in-home services and support that assist with activities of daily living, such as bathing, transferring, meals, and basic safety. There is no Medicaid or alternative safety net for these residents. Without support, the risk of abuse, neglect, and unnecessary nursing facility placement increases. This funding allows us to intervene early before decline becomes crises. Next slide, please. Again, you'll see who's represented in this program. The data shows disproportionate impacts on communities of color. These are residents who want to age in place, who are often solo aging and rely on county services as their only option. Next slide. Finally, respite services. 83 unpaid caregivers are currently waitlisted and at risk of burnout. Applications were temporarily closed on December 17th due to demand. Respite supports parents, spouses, and adult children caring for their loved one with complex needs. When caregivers burn out, cases escalate, often into adult protective services. So I want to highlight here the social services block grant funding was also included as flat funding in the February 3rd continuing resolution. I want to thank the entire county council, county executive, for their letters of support to Congress for both the Older American Act reauthorization and the social services block grant funding. We continue to advocate for both. This investment reopens access, provides relief, and prevents crises before they occur. Next slide. As with our other programs, the data reflects inequities in who bears the burden of caregiving without support. Investing in respite is a proactive strategy that protects both families and the county's broader safety net system. Next slide. This breakdown highlights the complexity of needs among those seeking respite. These are not short-term situations. They are ongoing caregiving responsibilities that, without relief, lead to long-term consequences for families and systems alike. Older adults and people with disabilities often have overlapping needs. Programs funded under the Older Americans Act are required to serve both older adults and individuals with disabilities, consistent with federal statute in implementing regulations. We are working to produce charts across all of our programs that highlights our integrated services. The integration of aging and disability services creates a single coordinated system that improves access, prevents crises, advances equity, supports caregiving, and uses public dollars efficiently. Next slide, please. Taken together, this $1 million supplemental appropriation stabilizes 3 critical programs. It supports aging in place, advances health equity, reduces caregiver burnout, and prevents and prolongs the higher cost of institutional care. Next slide. So, in closing, thank you for your time, your leadership, and your continued commitment to Montgomery County's older adults, persons with disabilities, and their caregivers. We respectfully ask for your support of this supplemental appropriation, and we are here and happy to answer any questions that you may have. Thank you.
Great, thank you very much, Dr. McGee, for that terrific presentation and background on these essential services. I'll turn it over now to our staff to walk us through the packet and the different decision points. Thank you.
Hi, everyone. Good morning. Thank you for the amazing overview, and excited to kind of delve a little bit deeper as we walk through the packet. So, as spoken earlier, today's session is in reference to a $1 million supplemental appropriation for the Department of Health and Human Services, and the appropriation aims to serve 3 service areas, or 3 buckets, including respite care, the senior nutrition program, and home care services, which I plan to cover in more detail. But first, starting with some background regarding the impact of the federal changes on services for seniors, there are 2 areas of note here. The first being the delay in the reauthorization of the Older Americans Act. The Older Americans Act provides the funding and support for several programs offered by the county, like the respite care program and senior nutrition. However, since the act hasn't been reauthorized, funds are unable to be dispersed from the program. With that said, the programs are still funded through an annual federal appropriations process, although the funds are remaining stagnant. The lack of reauthorization has also limited the senior nutrition program and the in-home supports that are provided through the home care services in the county. The second area of note here is the social services block grant, which in the county helps to support our social services to adults, our in-home aid services, and also adult protective services. The county provides these services through the HB 669 state grant, which is funded significantly by the social services block grant. And over the years, funding for the social services block grant has been reduced. And alongside that, with the passing of HR 1, or the One Big Beautiful Bill, this continues to threaten the future funding for the grant. So moving on to the first bucket is respite care in the amount of $250,000. Respite care is what we use to provide temporary planned relief to family caregivers who assist older adults, individuals with disabilities, and those with chronic conditions. The respite program currently provides families with up to 120 hours of service throughout the year. If the appropriation is approved, it is expected that the program would be able to provide an additional 7,575 hours of services to help serve 62 new families and 400 current families. Additionally, the program would be able to reopen their application until March, which would enable them to serve up to 126 new families who apply. Budget-wise, the FY26 budget for the program totals $2.1 million, with county funding making up $1.7 million and HB 669 funding making up about $198,000. During the FY25 budget deliberations, the council approved about $112,000 for the program rate increase, and DHHS reallocated unused inflationary adjustment funds to provide an additional $200,000 of support for a total increase of $312,000 to help address the growing demand. The next area that would be covered by the appropriation is the senior nutrition program in the amount of $450,000. The program provides nutritionally balanced meals and related nutrition services to older adults through congregate meals at community sites such as senior centers and rec centers. The program also provides home-delivered meals, also known as Meals on Wheels, and the appropriation, if approved, will support these programs in addition to the culturally appropriate meals program. The appropriation will also address the current waiting list for this program, which is at 141 individuals. The FY26 budget for the senior nutrition program is about $3.3 million, and as a note, the program has not received an award for all FY26 senior nutrition program grants yet. In federal fiscal year 26, the grant fund budget increased to help accommodate the increasing meal costs. And for the last area to be covered by the appropriation, this would be home care services in the amount of $300,000. The program helps to provide care services and light housekeeping to adults aged 18 and older who have functional disabilities and also need assistance with personal care, chores, or just activities of daily living. The goal of the program is to prevent neglect and unnecessary institutionalization, and the services are provided by certified nursing assistants under the supervision of a registered nurse. And the majority of clients for this program do not pay a fee, as their average income is below the threshold that would be needed to pay a fee for the program. The proposed funding would not alter the program structure or eligibility, but instead it would increase service capacity by expanding the number of residents who could be served by the program. Overall, the appropriation would be split into two areas. The first would be for $90,000 to hire 2 full-time brokers to conduct additional social services assessments. And the second area would be $210,000 that would be applied directly to the home care budget to help increase direct services. So what's meant by that is that it's anticipated that the appropriation would help the program to support about 30 to 40 new clients, and that the average number of weekly hours a client would receive would increase from 6 to 8 hours. And currently, the program has a wait list of 345 individuals. Thank you.
Excellent, thank you so much. Dr. Bridges, Dr. McGee, in the staff packet, there were a couple of questions just about feasibility of timely expenditures and thinking about our next budget. Any response or thoughts on those questions that were raised in the staff packet?
Absolutely, Madam Chair. I'm going to turn it over to Dr. McGee. She can give more insight, but if the question is, can we spend the money? Absolutely.
Yeah. I thought the answer was going to be yes, but it was put out there, so we should get it answered. Dr. McGee?
I do want to invite my leadership team to the table for ongoing questions. So to echo Dr. Bridges, absolutely, we can spend this funding. And so many of our programs that we've had, the 3 programs that we've highlighted here, we already have processes in place to reinstitute access. So I don't want to make it seem as though it's as simple as flicking a button, but it's sort of that simple for us. As far as our home care services, we would be looking to enlist services from former students that served with us, potential contractors that may have helped us do some assessments before. So we already have the proper documentation in place to execute that plan. As far as respite, like we said, we have a waiting list. We would reach out to our contractor. They already know those individuals would make contact the next day that we get these funds to start allowing them to access services, and same with senior nutrition. So, not sure if my team wants to add anything else.
Yep.
Oh, I'm sorry. Good morning. With the senior nutrition program, we are ready, set, go. As well, we have the wait list. We have contact information, so we are ready to make those calls as soon as possible to get seniors served with meals. Kimberly Johnson.
Yeah, Ms. Johnson. Actually, I had a question for you on the senior nutrition programs. In the packet on page 8, it lists the recreation department sites. And I was curious, because I think we do the aquatic center as well. Should that be on the list?
Let me remember to do that.
That's okay.
Yes, that is on the list. We
Okay.
updated that.
Great, perfect. I just wanted to make sure. Yeah.
Is that the new one in Silver Spring?
Yeah, it just wasn't, yeah, I think it just said, because it's the aquatic center, so I think
Correct.
sometimes it gets.
It's our
left
newest
off.
site.
Yeah.
It's our newest county recreation site, so it was left off by accident. It's about 3 years
Yep.
old, so it has been added to the list.
Yes, awesome, great. As the district council member for that area, just wanted to make sure it was on the list. I'll turn it over to the co-chair, Councilmember Sales.
Yes, I am so appreciative of all the work that you all do to fill in the gaps and, provide this social space for our residents who come into our rec centers to get these healthy, nutritious meals. The social aspect of these programs are so critical and oftentimes overlooked if you haven't had a chance to experience them. And then the caregiving aspect, whether it's a senior or someone who has a disability, it's not an easy job. In any way that we can improve compensation or relief to ensure that caregivers can take a shower, can rest, can go and get groceries goes above and beyond. And these programs are so unique to Montgomery County. We are certainly special in Montgomery County, and that's why so many residents want to call Montgomery County home. And so I appreciate my co-sponsors, as you mentioned, Council President Fanny Gonzalez, Councilmember Katz, who couldn't be here today. We also have Council Members Mink and Jawando, who have also signed on to support, and look forward to any additional questions that may arise.
Great. Councilmember Evans?
Sure, great. So first I want to thank Councilmember Sales, Chair of HHS, for this appropriation. I have a mother who's a senior and could very well use these services as well, so never want anyone to go without the services. With that being said, quick question. Can I make the assumption that the special appropriation will be an automatic that we're going to do next year?
No.
That we're going to be able to provide? Okay. And so, is there a way that we could let the people that are getting the additional service from this special appropriation to know that this is, like, I don't want to say one time, but will people make the assumption that because they're getting this support, they've been on this wait list, that it's going to be automatic, that they're going to receive the services going forward? Because people could make that assumption. Is that
Thank you for that question, Councilmember Evans. And I will let each program respond to that. So we do have embedded in many of our services where applicants have to reapply annually. So they understand that it's not a guaranteed service in some of the programs. And so to that end, I will turn it over to my team.
Yes, good morning, everyone. My name is Kim Mayo, Administrator for Community Support Network, and I oversee the RESTOR program, and that is one of the programs we have where annually families have to reapply. And at that point, they're notified of and even then, it's up to a certain amount of hours, pending funding availability, so people are aware.
Perfect. I just don't want to give people false hope, right? Yeah, so that's just me being new, wanted to ask that question. Thank you.
Yes, same here. We will make participants aware. And, the hope is that through attrition, as we highlighted in the packet, that we will be able to permanently move participants to get services ongoing.
And good morning. My name is Mario Warzas, and I'm the Administrator for Adult Protective Service Case Management. For those that were able to serve now with the appropriation, we're going to make every effort to continue. Now, we do a reassessment actually every 6 months, but we're going to make every effort that we can. And I really appreciate you all considering this, because it's Councilmember Sales says it's critically important to reach out to these folks, to screen, to assess, and if we can actually provide that personal care service, we want to do it.
Thank you. Councilmember Lukey?
Thank you, and I want to thank Dr. McGee and Mario for meeting with me separately, and my questions are going to be about specifically giving you an opportunity to unpack a little bit the comments you made that the wait list creates increased abuse and neglect opportunities, right? Because that's a big thing for me in terms of prevention and making sure we are keeping vulnerable people from harm's way. And so I wanted to give you the opportunity to talk about that and what that means in terms of this funding helping to reduce that potential harm in that very, it's not something people want to think about or talk about a lot, but it is reality and it's harsh. So thank you.
Sure. Good question. We know, we track how many folks come off the wait list, 2 to 3%. Actually, there will be referrals to Adult Protective Services, but there are other things that occur. There's institutionalizations we might have prevented. Folks might move, folks might pass. The best case scenario is we at least get out there and assess them. We screen them on a telephone, but if we don't have the staff and the resources, we can't do it. So the more folks we can touch, screen, assess in person, and if we can link up with services, the better it'll be for our community.
I just add, first of all, thank you, Councilmember Lukey, for taking the time to meet with us and understand that whole ecosystem and how it flows. So as discussed in that meeting, Adult Protective Services is mandated. So when we get those referrals, we are required to respond within a certain time frame. And there's several different categories of timeframes for our responses. So what that means is individuals that are waiting to be assessed for a home care and any other safety net service under social services to adults, they continue to wait because we have to respond to Adult Protective Services first. And so that can back up the system, if you will. And with a limited amount of assessors, and we are required to assess, required to respond, that prolongs access to services.
Right, and to your point, there is no other way other than being physically in person to do it. There just is no other way to know what the risks are, what the potential harms are, or what harms have already occurred. And so I want to thank you all and all the folks who work for you in that arena for everything they do. This is difficult work. It's emotionally taxing work, and it is very, very necessary work. So thank you.
Thank you.
Councilmember Friedson?
Yeah, well, first of all, thank you. I am wearing a different hat, although I would have been in this committee no matter what. This is my the merging of my previous and my current identity in terms of committee assignments. Want to thank and appreciate my former chair and my new chair, and welcome and appreciate that. And thanks for welcoming me to this committee. I'm really excited to be able to be part of these conversations moving forward. It's a huge issue, regardless of what vulnerable community we're talking about, and there isn't a larger vulnerable community to talk about in Montgomery County than our aging community, our older adult community that is growing 9,000 per year. The numbers used earlier were 4 times faster over 60 than under 60. It is a major challenge. So this special appropriation, I want to appreciate the chair for her leadership on this, and Councilmember Sales for everything that you're doing to champion this issue in the partnership with Health and Human Services as a first foray into your leadership on this committee. But this is going to be an ongoing question that we're going to have to address. There are fiscal constraints. There's also capacity constraints just in terms of having the number of people who can do this work. This is painstakingly difficult work. The things that we're asking folks to do in this space is grueling and challenging. It is, I hope, rewarding given how important it is, but it is really, really difficult. And to do it without a lot of help, without a lot of support, without a lot of backup, to do it without a lot of sleep. On the other end of the spectrum, I can speak to the circle of life and how that works. But it is really important. And to Councilmember Evans' point, we are going to have that conversation as we head into budget of what this looks like moving forward. This is an emergency stopgap to address these issues and this backlog that has real serious consequences, as was previously noted, but it does open up the conversation that we're going to need to have moving forward. So I'm very supportive of this, very appreciative of it. Ultimately, I think that the next steps are, as a committee, and I know that the chair is going to lead these conversations. I look forward to being part of them to figure out how do we meet this need? How do we address these concerns from a fiscal and a capacity standpoint? And we're going to need to partner with our nonprofit providers and with the department and the council to figure that out and to navigate those issues. And it's unfortunately needed now more than ever with the federal government stepping back from these historic social safety net responsibilities, and us at the local level with nonprofit partners having to layer in that extra bit of the mesh, so to speak, those layers of the social safety net. So thank you, appreciate it, and look forward to moving this forward.
If I could just respond to that, thank you, Councilmember Friedson. I appreciate those comments. One thing I do want to lift up is my appreciation for your PSA for respite that you did. If you haven't seen it, it's very insightful, so thank you for that. And as you noted, I'm sure you could use some of that right now.
Yeah.
So clinicians, you touched on that. Direct support professionals, social workers, nurses. We are facing a nationwide shortage across the board of needed clinicians. So my team, Mario, Dr. Johnson, Kimberly, they are all working, to look at this through a different lens and move beyond the historic way. We are all looking at it from a diversified lens to move beyond what has been to where we need to go. Right? Because we're going to continue to grow, we've noted. So looking at working with our university systems to get a pipeline, right? We've worked on, the county executive some years ago, mobilized a task force to examine direct service professionals. And we came up with a myriad of about 26 comprehensive recommendations that we're still working with WorkSource Montgomery to try to move forward, working with different partner groups to move some of those recommendations forward so that we could shore up the direct service professional workforce. Because in order to provide home and community-based services, that workforce is essential. Without that workforce, this work could not happen. So constantly looking at how we can recruit and retain those individuals. Also looking at funding, our funding levels. Historically, we've received funding from the federal government, as been mentioned, through a state pass-through. We're working with the Maryland Department of Aging and many of our state partners, Maryland Department of Health, to really look at how we diversify and come up with new funding streams. There's a lot of grant opportunities that are out for many of our nonprofits, so we're constantly sharing that information with them so that they can access those dollars and provide support to older adults and people with disabilities. So it is an ongoing commitment, passion among this team, and a calling, I would even say, to do this work and show up and champion the cause for the county's most vulnerable. So thank you for that.
So thank you, Dr. McGee, you and your exceptional team, but not only the exceptional cadre of leaders that we have in the Department of Health and Human Services across all the spaces. This is the team. This is a team that is ready to move forward and address many of the needs. And I always like to end by saying we will get there together. And what does that mean? It means with our team, it means with the council, it means with the executive staff, and more importantly, with the community. But Dr. McGee, all the great work that you and your team, as Councilmember Jawando likes to say, for all the millions of viewers who are watching at home, there's a number, 240-777-3000. Call that number if you have any questions about anything that you've heard or viewed today regarding home health service, respite care, or our senior nutrition program. Our team is ready to respond. Thank you.
And if I might, just as you mentioned, I know, that was the close, and I'm sorry to interject, but I do want to lift up the fact that Councilmember Jawando did hold a recent event at the Bonifant where many of these programs and services, along with resources from the Services to End and Prevent Homelessness, were highlighted, and we had an opportunity to really talk with those residents and share this resource information. So just want to highlight that as well. Thank you.
Yes, for the millions at home that can't see, we do have Dr. McFarland here from the African American Health Program, and I am appreciative of the statistics that you shared. I know that initially, we wanted to ensure that there was equity involved in the allocation of these resources, and as the data has shown, a majority of the subscribers to these programs are from our communities of color, and so we are so appreciative that we are in a position to extend a helping hand to our residents in need. And to Councilmember Luedke's point, I know we shared the general number for aging and disabilities, but if someone is experiencing abuse and neglect, is that the same number that they use?
Yes, so that is the number that you see represented here, 240-777-3000. 3000, that is the number to our Aging and Disability Resource Unit, which serves as the Maryland access point for any older adult or person with disability or their caregiver to call to get connected to a host of programs and services offered through the county and through with our contractor partners. So that is always the number to go to. We do, however, for our adult protective services, have a state line called Adult Services Intake. But if an individual calls this number, they will be transferred over. So Mari, I'm not sure if you want to add anything else about ASI.
I like the 240-777-3000. It has a ring to it. It's easy to remember. State has 1-800-91-PREVENT if you have an old phone and you can, figure out the numbers. And that's for both adult protective services and child protective services. So you have two options, but we do encourage the local number.
Thank you. All right. Well, thank you, everyone. And I just want to add my thanks to the team and also just how much, Dr. McGee, you mentioned you're in the community. And I think one of the things, as we were just talking about with this phone number, is so important is making sure our residents know about these services and know what's available. And so we really appreciate you all not just doing the intake and your jobs, but being out there so much. And there are so many people in our senior population and others who, when they see you, you are the face of our county government. And that is so important to many people, especially those who may feel isolated and not sure where to turn. So I just want to thank you all for that. And with that, all those in favor of recommending this special appropriation to the full council, please raise your hand. And that is unanimous of those members present for the two committees. Congratulations. Thank you all for being here this morning. We will now turn to our next item, which is a special appropriation resident and community gardening grant program for $100,000. And I know we have our Director of Office of Food Systems Resilience with us. Director Bruskin, as you're getting yourself settled, I'll turn it over to Ms. Clemens Johnson just to walk us through the packet and then give you an opportunity to speak to this.
Good morning. Thank you so much for Dr. Bruskin for being here, a mighty team of one representing her office. So we are talking about a special appropriation of $100,000 excuse me, for the Resident and Community Gardening Grant Program. This program began under the Strategic Plan to End Childhood Hunger, which was launched, I believe, FY 2022, FY 2021 by our former HHS Chair, Councilmember Albornoz. So for FY 23 was the first year of the Resident and Community Gardening Program. And if you go through the packet, you'll see that we provided some information about who was actually funded through this program. The previous budget has been $200,000 for the program. During the budget exercise last year, the council agreed to reduce the budget by $100,000 due to budgetary concerns that were outlined by the council president at that time. So the program was reduced. And so, and also I'll note that it was funded in FY 24, but the funding, but the grant program began at the end of FY 24, so June of 2024. So sorry, I'm losing my voice this morning. So the program, yes, so the program was not funded in FY 25, and then in FY 26, as mentioned, the grant program was reduced. And so this program, so this funding was introduced by Councilmember, Council President Fanny Gonzalez to shore up the program to its FY 24 funding levels. I did not include this in the packet, and I doubt that the office can speak to it, but my thought is that if this $100,000 is funded, that it will bring the program to $200,000 at the FY 24 funding level. With the NOFO going out and awardees needed to be decided, it will probably run into the same cycle again, where the grant award would probably start like May or June of this year, which would run across FY '27. So even though we haven't seen the budget, there likely won't be a need to fund this program with FY '27 funds if we fund this appropriation. So just want to put that out there, but that's totally from me, not from what my assumption is of the budget. So if there's any questions, I can certainly answer them.
Great. Director Ruskin, do you want to add?
Just good morning, everyone. Thank you so much to the committee chairs and to all the council members here today for the opportunity to get to discuss this opportunity. This is a meaningful program that not only supports climate priorities and emotional wellness that is brought to residents through working in the soil, but also just last week, DEP released the results of a survey that they had done of Montgomery County community gardeners in partnership with the Climate Justice Fellows, and they found that the large majority of all of those gardeners, which was a small sample, but still were significantly reliant on the products from their gardens to feed their families. And so I think we often expect the impact of putting food on our tables through local gardens, but that is also an important factor. So, and thank you to Ms. Clemens Johnson. I can concur that the timing that she proposed is what we are thinking.
Great. Excellent. Anyone have any questions or thoughts on this appropriation? Chair Sales?
Just a quick question on how we're evaluating the programs for success, and then where exactly is the money going to? Do we have a specific garden, specific community that this money is going to be allocated to?
Thank you for that question. So we have not released the notice of funding opportunity yet, pending the outcome of the special appropriation, and appreciation to the council president for her leadership on this. But the goal is that this is a competitive grant program that will be open to all initiatives in the county, but it can be difficult, even though they're all gardens, it can be difficult to compare apples to oranges sometimes in very small community projects versus larger multi-year. And so we're thinking strategically, looking at the results from our FY24 projects about what was most successful, where we can leverage public and private resources for long-term sustainability of these projects, because part of it is set up in original operations, but the other part is ongoing use of the garden and those costs. So we're carefully looking at all of those pieces, but the goal would be that these are community-led projects that have a balance of both education and meaningful food production.
All right, thank you.
Great. And Ms. Clemens Johnson, thank you for the packet. I think it's also really helpful to have, sort of look at who's received grants in the past as the office is looking at how to do the evaluation. So it's really helpful. Anyone else? All right, not seeing any other questions. All those in favor of recommending this special appropriation to the full council, please raise your hand. And that's unanimous of those present of the joint committee. Thank you, Ms. Clemens Johnson. Thank you, Director Bruskin, for being here. We look forward to seeing that NOFO go out. So thank you all. Those were our two items for this morning. That clock is wrong, just as an FYI to my colleagues. It is just 10:22. So being on the 7th floor is like being in a different zone here, parallel universe. So our Government Operations and Health and Human Services Joint Committee session is now adjourned. Thank you, everyone.
Thank you.
I know, I looked at the